Emily.
Great. Thank you so much for the introduction, Sue. Again, my name's Emily Namey. I'm with the Aspires Project at FHI 360 in the States. And on behalf of my colleagues listed here on the slide, we're really excited to have this opportunity to talk about some highlights from our work that we've recently completed in Abidjan, Côte d'Ivoire, to better understand the financial lives of female sex workers. So quickly, why talk about the financial lives of sex workers in the context of HIV prevention? For this audience, the link is probably fairly clear, and I've had a nice setup by Elena. But as we know from the literature, financial hardship is a major driver of women's entry into sex work. This is often precipitated by some kind of shock, either the death of a parent or a spouse, some other kind of financial hardship, and in the context of an environment with limited opportunities, economic opportunities for women, this hardship can drive women into sex work as an income-generating activity to support both themselves and their dependents. From there, as we know, the risks of HIV are increased in several ways, and economic strengthening programs are designed to address the upstream sources of these risks by seeking to stabilize finances, increase economic resilience, and provide economic empowerment. So it was within this context that the PEPFAR Key Populations Technical Working Group requested that Aspires help address gaps in the evidence base about how to provide economic strengthening programs, or ES, for these women. We were tasked with describing the financial lives and financial service needs of the FSWs in Abidjan to inform the development and implementation of a pilot economic strengthening program sponsored by the USAID mission in Côte d'Ivoire as a way of reducing HIV risk among this population. We used a mixed methods approach to do this. To collect qualitative data, we asked 74 FSWs to let us walk and talk with them during their daily non-working routine. The study team referred to guiding questions to help focus their conversations, though all questions were posed informally within the context of whatever was going on. Discussions lasted on average about 2 hours and focused on income, spending, savings, and borrowing, which is how the results are structured here today. We then conducted an applied thematic analysis and organized findings around those 4 domains. Additionally, a subsample of 33 women took part in a financial diary activity every week for 6 weeks. Each woman received instructions to note all inflow and outflow transactions over the course of a week, and at the end of each week met individually with research staff to discuss those transactions, to have them recorded in a formal Excel template, which we later aggregated across the 6 weeks for each sex worker, and also in total, and then disaggregated by sex worker type as well. We defined sex workers, to answer your question, according to the UNAIDS definition, and added eligibility criteria of having had 3 or more transactional sex events with at least 2 different partners over the past 2 weeks. We worked with local agencies that provide services to FSW to recruit for the study using a purposive sampling approach to draw women from across the 10 districts of the city and within each of the environments where they work. To describe our sample briefly, the median age was 28, with a range from 18 to 55. Nearly half of the women reported no formal schooling, and the majority of women were Ivoirian, though we had representation from 6 other West African countries as well. In terms of their sex work profile, at screening, 75% of our sample reported 6 or more partners over the past 2 weeks, and more than half of the women reported more than 11 sex acts during this time. You can see here the breakdown of our sample according to the locations or types of sex work, with just a few hotel-based sex workers and the rest relatively evenly split among bar, brothel, luxury, and street-based sex workers. Finally, in terms of their financial characteristics, 1/5 of the women reported some income other than sex work, 70% were supporting at least one dependent, and nearly 60% of the women reported borrowing money more than once in the past month. So I'll turn to our findings with the caveat that these are very high level. First, to income, based on the data from the financial diaries, women in our sample reported an overall median income of about 55,000 CFA, or roughly $100 per week. This represents the middle of a very wide range, though, from 12,000 to 162,000 CFA per week. And just for comparison, a recent post-crisis assessment of income among Abidjan's poorest neighborhoods found weekly income between 32,000 and 63,000 CFA. So FSWs were closer to the top of that range among the more vulnerable populations in Abidjan. If we look at all incoming cash and goods, it's clear that sex work is the predominant source of income. So the blue bars here are 64 to 95% of income from sex work. There were some contributions from cash gifts in the red, loans in the green, and for brothel and street-based sex workers, some petty trading represented by the purple. I'm going to look at the red boxes here for just a minute because while cash gifts were often relatively small in value, roughly $25 per transaction, they were fairly frequent. 85% of the financial diary participants reported receiving a cash gift at some point during the 6 weeks. And we see here in the top table that in aggregate there were more gifts received from men. However, gifts received from women were of greater value per transaction. In the bottom table, you can see the individual sources of those cash gifts, and here stable partners contributed the most in total dollar amount, followed by peers and extended family. If we switch to expenditures, you can see the distribution of the top 10 categories of spending among our financial diary participants, almost all of which relate to costs of daily life. So the top 7 categories here are food, household supplies and utilities, clothing, transportation, outgoing cash gifts, beauty supplies, and communication. These were reported by 30 of 33 participants and on average accounted for $90 of spending per week, and then again is out of an average of 100. So most of their costs were related just to getting by in daily life. However, we also asked women to report the purpose of their expenditures, and 28% of their spending over the 6-week period was directly related to costs of sex work, from clothing to beauty, condoms and alcohol, right to work payments, and charms and offerings that they purchased to attract more clients. So when we include spending for mixed purposes to that, things that could be used both for sex work and for daily life, we see that work-related expenses rises to 61%. In terms of borrowing and saving, I'll focus on data from the narratives to describe general trends. In the qualitative data, we saw loan amounts ranging from less than $2 to over $500, but among those who regularly borrowed, most often the loans were modest, around $30 or less. This was borne out by the financial diary data as well, where the average was around $35 per loan. And most participants reported borrowing just as a form of cash advance, when they had a slow week and they had rent coming due. And again, these were to pay for more usual routine costs, not big, strange expenses, irregular expenses. The loans were reportedly repaid within a few days to a month whenever the woman had the money, and these were without interest. Women stressed that trust was a major factor in choosing a lender, and in the financial diaries showed a strong trend toward borrowing from other women, mostly peer FSWs. When it comes to savings, the primary goal was to have a short-term reserve to cover daily expenses. Banks were seen to make money inaccessible for these purposes and also posed other logistical barriers. However, many participants mentioned dreams they had: to open a business and leave sex work, to buy a house, to support their children, to obtain needed and delayed health care, or to return to their home country. And for these, they would like to have long-term savings in a secure account. Tontines were also well established and popular among subsets of women. So a tontine is an informal group-based savings that women pay into on a weekly basis and later receive a lump sum payout from. Their use among brothel and street-based sex workers is unsurprising, as these women more typically live near one another and have a better formed social foundation on which to build the group. So based on these data, we offer several recommendations for ES programs for FSW, at least in the context of Abidjan. First, women's reported weekly incomes were relatively high. Women typically had cash available, they were not food insecure, and did not report a heavy debt burden. So this to us reduces the impetus for asset transfer-based interventions, or those that would provide cash or goods directly. Next, it's clear that the range and value of informal lending and borrowing strategies provide some economic resilience for these women. The tontines in particular, where they exist, suggest that a more formalized, community-based savings and loan approach could be successful. The women's interest in more formal financial services for saving also point to opportunities for linkages to the formal financial sector. And as we heard from Elena's talk, the importance of social relationships and trust are woven throughout the narratives and reflected in our financial diary data as well. Though men provided most of the women's income through sex work, social relationships with peers, family members, and particularly other women factored heavily in economic transactions and provided a financial buffer in the form of no-interest loans and the tontines. The relative strength of peer networks we observed, along with the shared social protection roles that women discussed in their narrative, so warning of incoming police raids, for example. Again, these suggest opportunities for group-based approaches to delivering paired economic and HIV prevention interventions within social group networks. And finally, women expressed tremendous interest in our financial diary study. We had to turn participants away, and after enrollment, retention was unusually high. This, along with the women's positive reflections when we returned back to them their 6 weeks of data, demonstrates their appreciation of and demand for financial education efforts. Additionally, we witnessed lots of innovative non-numeric record keeping employed by women with limited literacy and numeracy skills, providing evidence of the feasibility of financial management without traditional forms of record keeping. So to conclude, the data we collected were tremendously rich, and we hope to replicate this work in other areas, maybe with a larger sample size, with a longer time horizon, to provide a broader evidence base for comparison. But together we hope that these data and the recommendations that they engender will help guide work in the direction of integrated approaches to HIV prevention for female sex workers. So HIV is absolutely the problem, and the problem that brings us together for this meeting was the impetus for this research. And yet, as we know, even in the context of HIV, female sex workers are not simply vectors. They're women making economic transactions based on the resources and opportunities available to them. And so I'll leave you with a quote from a woman in our financial diary sample who summed this up beautifully in her exit interview. She said, "This project is an opportunity for us. This is the first time they did not come to talk with us about AIDS, but to help us manage our money. Thank you very much." And so I will just acknowledge and thank the women